Microneedling can help stimulate hair growth, especially in the early stages of hair thinning. Tiny needles create controlled micro-injuries in the scalp, which triggers the body's natural healing response. This increases blood flow, releases growth factors, and may activate dormant hair follicles. It also improves the absorption of topical treatments like minoxidil. Research suggests that microneedling combined with minoxidil produces better results than minoxidil alone. On its own, microneedling can still help some people, but the improvement is usually more modest. That said, it's not a cure for baldness. If hair follicles have been completely dead for years, microneedling won't magically bring them back. It works best for people with thinning hair rather than completely bald areas. If done properly, using the correct needle length, and keeping everything sterile, microneedling is generally safe. Doing it too often, pressing too hard, or using dirty equipment can damage the scalp or cause infection. So the evidence is clear. Microneedling is a legitimate tool for promoting hair growth, especially when combined with proven treatments, but it isn't a miracle solution. Microneedling can be an effective treatment for hair growth, but it isn't without risks or limitations. The most common side effects are temporary redness, soreness, itching, and mild swelling of the scalp, which usually disappear within a day or two. Because the treatment creates thousands of tiny punctures in the skin, there is also a risk of infection if the needles or equipment are not properly sterilized. Some people experience a temporary increase in hair shedding during the first few weeks of treatment, but this is often part of the hair growth cycle and usually settles over time. Microneedling can also cause problems if it is performed incorrectly. Using needles that are too long, pressing too hard, or treating the scalp too frequently can damage the skin, increase inflammation, and in rare cases even lead to scarring. It is also not suitable for everyone. People with active scalp infections, open wounds, eczema, psoriasis, or a history of developing keloid scars should avoid microneedling unless a dermatologist recommends it. Another important limitation is that microneedling is not a miracle cure for hair loss. It works best for people with thinning hair and active hair follicles, but it cannot revive follicles that have been completely destroyed or inactive for many years. Even when it does work, results require patience. Most people need several months of consistent treatment before noticing meaningful improvements. When performed correctly with clean equipment and the proper technique, microneedling is generally safe, but its success depends on realistic expectations, good hygiene, and avoiding the common mistake of thinking that more frequent or more aggressive treatment will produce faster results. Using microneedling correctly is just as important as deciding to use it in the first place. While the treatment can help stimulate hair growth, the benefits depend heavily on proper technique, good hygiene, and allowing the scalp enough time to heal. Most of the problems people experience with microneedling, such as irritation, infection, excessive shedding, or even scarring, are caused by poor technique rather than the treatment itself. Taking a careful and patient approach gives your scalp the best chance to heal properly and encourages healthy hair growth. The first step is choosing the correct needle length. Different needle sizes serve different purposes, and using the wrong one is one of the biggest mistakes beginners make. A 0.25mm needle does not reach deep enough to significantly stimulate new hair growth, but it is useful for increasing the absorption of topical products such as hair growth serums or minoxidil. It can usually be used 1 to 3 times per week. A 0.5mm needle is the most popular choice for at-home hair growth because it reaches deeper into the scalp, where it can stimulate the body's natural healing response and activate growth factors around the hair follicles. Most experts recommend using a 0.5mm device about once every 7 to 10 days. Needles measuring 1.0mm to 1.5mm penetrate much deeper into the skin and should only be used every 2 to 4 weeks. These longer needles are generally better suited for trained professionals because they carry a greater risk of pain, bleeding, infection, and scarring if used incorrectly. Before every session, hygiene should be your highest priority. Wash your hands thoroughly with soap and water, then wash your scalp to remove dirt, oil, sweat, and styling products. The microneedling device must also be disinfected before every use. Soak the needles in 70% isopropyl alcohol for 5 to 10 minutes, then allow them to air dry completely before they touch your scalp. Once the treatment is finished, clean the device again, disinfect it the same way, and store. In a clean, protective case, never share a dermaroller or microneedling pen with another person, even if it appears clean, because bacteria and viruses can be transferred through tiny amounts of blood or skin. If the needles become bent, dull, rusty, or damaged, replace the device immediately. Sharp, clean needles create precise micro-injuries, while dull needles can tear the skin instead of puncturing it cleanly. When you begin the treatment, work slowly and gently. Divide your scalp into smaller sections, so every thinning area receives equal attention. If you are using a dermaroller, roll it lightly over each section in 4 directions: vertically, horizontally and diagonally in both directions. Lift the roller after each pass instead of dragging it across the skin, because dragging can scratch the scalp. If you are using a microneedling pen, gently stamp the device over each section according to the manufacturer's instructions. There is no need to press hard. The needles are designed to enter the skin with light pressure. The goal is to create controlled micro-injuries, not deep wounds. Mild redness is expected, and with longer needles, you may occasionally see a few tiny spots of blood, but heavy bleeding, severe pain, or large amounts of blood are signs that you are using far too much force. The care you give your scalp after microneedling is just as important as the treatment itself. Your scalp will be temporarily more sensitive because thousands of tiny channels have been created in the skin. Avoid touching or scratching the treated area with your fingers, since this can introduce bacteria into the scalp. Do not apply alcohol-based products, heavily fragranced hair products, strong acids, or harsh chemicals for at least 24 hours, because they can cause unnecessary irritation. If you use minoxidil, many dermatologists recommend waiting around 24 hours after treatments with 0.5 millimeters or longer needles before applying it. This helps reduce burning, irritation, and excessive absorption through the freshly treated skin. During the first day after treatment, avoid swimming pools, hot tubs, saunas, steam rooms, and intense exercise because sweat, heat, and bacteria can increase the risk of infection while your scalp is still healing. If you spend time outdoors, protect your scalp from direct sunlight by wearing a clean hat, since freshly treated skin is more vulnerable to sun damage. Allowing enough recovery time between sessions is essential. Hair growth does not occur because the scalp is constantly injured. It occurs because the body repairs the tiny controlled injuries created during treatment. If you microneedle too often, you interrupt the healing process and may increase inflammation instead of encouraging healthy hair growth. A 0.5 millimeter treatment once every week is enough for most people. Longer needles require even more recovery time, often 2 to 4 weeks between sessions. More frequent treatments do not produce faster results and can actually slow progress by preventing the scalp from healing properly. There are also situations where microneedling should not be performed. Never use it on areas with active scalp infections. Open cuts, severe dandruff with broken skin, eczema, psoriasis flare-ups, sunburn, or any condition that has damaged the skin barrier. If you have a history of developing keloid scars or poor wound healing, consult a dermatologist before starting treatment. People taking medications that significantly thin the blood, or those with certain medical conditions, should also seek medical advice before using microneedling. Finally, keep your expectations realistic. Microneedling is not an overnight solution, and it cannot bring back hair follicles that have been completely destroyed. Most people who respond well begin noticing subtle improvements after 3 to 6 months of consistent treatment, with more visible changes often appearing after 6 to 12 months. The best results are usually achieved when microneedling is combined with scientifically proven treatments such as minoxidil or other therapies recommended by a dermatologist. Success comes from consistency, patience, proper hygiene, and gentle technique, rather than aggressive treatments or frequent sessions. By following these guidelines carefully, you can maximize the potential benefits of microneedling while greatly reducing the risks of irritation, infection, scarring, and unnecessary hair shedding.